Hello, welcome to our presentation over breastfeeding. Before we begin the presentation, I ask that you type in the link that will be displayed in a few moments. This is a link to a Google form that you can fill out as you go through the presentation. It will ask a few basic questions from each section of information. Hopefully this will help you focus on the important information we want you to gain from this presentation, as well as helping you understand the information better. Thanks and enjoy the presentation.
A common concern that many parents have is wondering if their baby is receiving enough breast milk. It is normal for babies to lose a small amount of weight in the first few days following birth. The baby, however, will steadily regain its weight at 1 week. Weight gain from birth to 3 months ranges from 2/3 of an ounce to 1 whole ounce each day. There are several signs that the baby is getting enough milk. To start, if the baby is content, that is a good sign that they are receiving enough. Other signs besides weight gain and the baby's content expression includes if the baby passes enough clear or pale yellow urine. Another sign is if the baby switches between sleepful periods to alert and wakeful periods. Additionally, if the baby is having plenty of bowel movements, that is a really good indicator that they are getting enough. On day 1, the first bowel movement generally occurs within 8 hours after birth. From day 2 to 7, the baby should have 3 bowel movements per day. The color and texture of the bowel movement will also vary depending on the day. Lastly, mom's breast could feel softer after she breastfeeds the baby. That's a sign that the baby got enough milk. So from this, following the teaching, mom will be able to identify the signs that her baby is getting enough breast milk from each feeding.
So for one of our learning objectives, we decided to do that the patient will demonstrate knowledge of correct breastfeeding positioning and latch techniques. To start this, we'll start with positioning techniques. You want to make sure that the mom is supporting her back well. She can use pillows, cushions, footstools to provide support and comfort while she is breastfeeding. Whenever she's holding the baby, she wants to make sure that the baby's head and neck are straight, that they're not twisted. You want to make sure that the face is facing the breast and that the nose is opposite of the nipple. And you want to make sure the baby is as close as possible with the arms and hands out of the way of the nipple. You also want to make sure you're supporting the newborn's whole body, their head, their neck, their back, and their bottom. For supporting the breast, you want to make sure that your hand is resting against the chest wall under the breast. Your thumb is over the breast and your other 4 fingers are underneath it, and that the fingers are away from the areola. You can remove your hand from the breast when the baby has a good latch. To get a good latch, you want to support the baby's head, extend the baby's head slightly so that the nipple is aimed at the roof of the mouth. You want to lightly touch the lips with the nipple and wait for the baby to open his mouth. You want to bring the baby to the breast, not the breast to the baby. If it shouldn't hurt breastfeeding, but if it does, you can put your finger in the corner of the baby's mouth and break the seal of the suction, and rest, relax, try again later. For signs of a good latch, how you know if you have one, the baby's mouth will be wide open, lips flipped out. There should be more areola above the mouth than below it. The chin will be pressed to the breast, and you will hear pauses in between the sucklings.
Okay, so our presentation is over breastfeeding. So breastfeeding education is important for all mothers, even those who don't necessarily plan to breastfeed, because something could happen along the way. They could change their mind. They could maybe see the benefits and decide that they want to breastfeed, or even decide to like supplement breast and bottle. So it's important that they know the skill because it's not always something that comes naturally to them. So assessment is going to be really important with breastfeeding.
It needs to be done because obviously you need to know if the mom is doing it correctly. So you need to make sure that the baby's getting adequate feeding. And you need to assess the mom after you do the teaching from like a verbal, what's the word for that?
Like an assessment.
Like a verbal assessment. You need to make sure that she's doing it, or that she can like tell you that how to do it. And then also once she starts breastfeeding the baby after the birth, you need to make sure that she can demonstrate it and make sure the baby's eating properly. And then some key points. So you want to feed your newborn every 2 to 3 hours, especially when they're little. And then of course, as they get older and their stomach gets bigger, then that will change. But you want to switch from breast to breast every 10 to 15 minutes, and this prevents engorgement. You want to keep your newborn midline because this will help with digestion. So that's their ear, their shoulders, and their hips need to be all lined up. So it can be hard to know if your baby is properly eating, but if you can hear the baby sucking in a quiet room, if the newborn is nursing at least 8 times in a 24-hour time period, if your breast appears to soften after they fed, the number of wet diapers should increase daily until day of life 5. And then it should maintain 6 to 8 wet diapers a day after day of life 5. And newborn stools should lighten in color and become yellow by day of life 5. And if these things are occurring, then the baby is getting plenty of eat.
It's also really important to keep in mind that your attitude is important when breastfeeding. It's important that you don't get frustrated. The first couple days can be really hard as the baby adjusts to sucking and getting the reflexes down. So it's just important to keep in mind that they are getting something, so they are getting fed, but if you get frustrated, it's really not going to help. You want to try to stay as relaxed as possible. This will encourage the baby. And I mean, oftentimes it seems that they can sense your frustration, so if you stay calm with them and let them adjust, it'll work out better for everyone. If things aren't going right, if something doesn't seem to be going right, if you just have like a bad feeling about something, don't be afraid to ask for help immediately. I mean, since it is the way that the baby's getting fed, it's important that you get help immediately, and being ashamed is, I mean, it's not going to be helpful. It might seem a little weird, but it could be something really, really common, or it could just be that something really isn't going right and you need help with it. So it's important to do that as quickly as possible and to not feel ashamed, because this is something new, especially for new mothers. They've never done this before. They don't know what's going on, so they need the help. It's also important to keep in mind if you do find something wrong that prevents you from breastfeeding, or solely breastfeeding if that was your plan, that it doesn't mean you did something wrong. It doesn't mean that you're a bad mother or anything like that. It just doesn't work, but you can still have a really good relationship with your baby and still be a very good mother to them. There are several benefits to breastfeeding, and our book highlights several of them that we use in class. As far as nutrition, breast milk provides like ideal nutrients for the baby, specifically for them, from the mother to the baby. And the composition varies as they get older, whereas you would have to switch between types of formula as the baby gets older. This is going to have what they need for how old they are. This also gives the baby a type of immunity. It passes antibodies from the mother to the baby, so it helps them fight off infections from a very early age. And it's also important to note that it's hypoallergenic, so it's very unlikely that they would have an allergic reaction to it, whereas they might have an allergic reaction to something in the breast milk or the bottle milk formula. It will also help the mother return to her pre-pregnancy weight faster, as it burns a lot of calories as you are breastfeeding, and it's associated with a lower risk of breast, ovarian cancers. As far as between the mother and the baby, it can help with bonding as they spend a lot of time skin to skin. And then the hormones of lactation promote a maternal feeling and sense of well-being, so it can help the mother. A lot of times mothers will enter like almost like a depression after delivery, so this will help them feel as though they're doing a good job, you know, things are just going well for them. And as far as convenience, the milk is always going to be the perfect temperature if it's out of the breast, whereas if it were, say you had to prepare a bottle, or it was frozen, if you were pumping, you would have to take time to prepare the milk. This way it's always going to be fresh and ready for the baby. And then colostrum is the first milk produced. It actually is produced before the baby is born, as like sort of like the middle of gestation, and it might start leaking before birth too. But this colostrum is beneficial because it contains a lot of protein and vitamins and minerals, and also has a lower fat and lactose concentration, which is good for the baby and can't always be provided with like bottle fed supplements.
So some tips for breastfeeding. You want to avoid switching from the breast to bottle because it can lead to nipple confusion, and that obviously leads to ineffective feeding of the newborn. You want to find the best position that works for you and your baby. So for example, moms who's had C-section, since there's that open wound right there, you may find it helpful to choose a position that holds the baby away from that incision. So like that type of hold would be like the football hold. You want to allow the baby to come to the breast, instead of forcing the breast into the baby, because this will help encourage optimal latching, and then that will encourage better feeding experience. And the AAP, American Academy of Pediatrics, recommends exclusively breastfeeding your baby for 6 months, and then continuing breast milk and introducing solid foods up until the baby is 12 months old. So that's
our presentation.
Okay, so if we would have been in class, we would have had a handout to give out for our project, which I made, and ours was on newborn breastfeeding. So I made a little brochure. It printed a little funny, but that's fine. I'm still gonna run through it. So when you first open it, ideally this would be the first page, and it just explains what this pamphlet's for. So it runs through if moms are having difficulty breastfeeding and they're questioning their technique or the reaction of their baby, or if they're getting adequate amounts of milk, it'll tell them how to know if their baby's getting enough milk, and then it'll also run through just different tips and stuff on how to improve the feeding. So that's what the inner portion's about. So it says how to know if your baby's getting enough milk, and then it kind of reassures them in this first little paragraph right there, just kind of saying if it's a new experience, it's okay to be questioning if you're doing it well enough or if the baby's getting enough milk. It's kind of just a reassurance to the mom. And then right under it are a few tips that Aslee would have gone over in her portion as well. And then also just a little thing for mom as well, kind of to show her what she could look for too. So it says, from a maternal standpoint, the appearance and or feeling of her breast can also help indicate how feedings may be going. And then ideally her breast would be a little bit softer after completing a feeding and less full because the baby had just eaten. And then once you get to the back side, it runs through how to get a good latch, and then proper positioning techniques, which Tessa would have run through as well. This kind of just summarizes it. So for proper positioning, I have 3 little boxes. The first one tells the mom how to properly support herself and things she could use, like pillows, cushions, and that kind of thing. And then the second box goes over just a brief summary of how to hold the baby correctly and make it less discomforting for both of them. And then how she could support the breast itself to get a good latch and get the feeding going is the last box. And then on this page, I run through basically the main idea of how to get a good latch, and then you have supporting the head, stimulating a latch, how to bring the baby towards your breast rather than bring the breast towards them, which might make her a little bit more discomforted and cause her more fatigue, get her tired more easily. So there's that. And then how to deal with pain and discomfort, and then just signs of a good latch on the bottom. And then that is what the full thing looks like, and it's just a good rundown on things that she might not have known or things that she could use to make it a little bit easier for her. So that's it.
That concludes our presentation. If you have any questions or concerns about any of the information, feel free to email any of us. Thank you.